Bismillah ar-Rahman ar-Rahim. So, our further Bismillah ar-Rahman, continuation of our topic surgical supplies. Today, the second lecture of this topic. So, we have to learn today about bandage, adhesive tapes, and combined primary, secondary wound dressings. These are the dressings. So first, bandage, you have seen the bandage. Mostly you have an experience that sometimes you have cuts over there, sometimes happens to you, and they used to go and they apply bandage over there. कभी आपको कट लग जाते हैं जो तो आपने देखा होगा कि आपने बैंडेज अप्लाई की रेट से इट्स मेड अप ऑफ कॉटन कॉटन की बैंडेज अप्लाई की जाती हैं. What the use of that one? It has to push the pressure over the wound over there. They also use for support. They are also in elastics, and they are also elastic, rigid. These are various characters of that the bandage has to be applied. So, where is the types of bandage you have may seen in this picture over there? Gauze roll bandage made of gauze cloth, muslin bandage. These are the cotton bandage, elastic bandage, orthopedic bandage, stocknet bandage, cast bandage. These are the various types of bandage are available now. You can see in this, the lady has a fracture and she is wearing that one, triangular bandage. Then gauze roll bandage. Sometimes you have a bandage, you have a cut over there, and you have to put that bandage over that area. Tensor bandage, when they want to fix over there, to keep the dislocation, then the tensor bandage have to apply. Then tubular bandage over have to apply when there's a elbow, wherever there's some pain over there. These are the various types. So there are gauze rolls bandage, muslin bandage, there are cotton bandage, elastic bandage, orthopedic bandage, stuck bandage, cast bandage. Can you mute your mics? First one is gauze roller bandage. You may see this type of on the lower pic, you can see a gauze roll bandage over. It's in continuous form. So one continuous piece of that gauze cloth has to be placed as a bandage, tightly rolled. Mostly when for commercial packing, they're very tightly rolled, then free from shedding. They do not shed anything. So there are the gauze roller bandages. Whenever there's a need, they has to be fixed over that area. These are the gauze roller bandage. Then there's the cotton bandage rolls. Different than that of gauze rolls. It is that what they do, made of heavier unbleached material. The natural cotton has to be used. The cloth has to be used where gauze bandage not provide support. So when there's a more heavier, most supportive need where these are applied. Hold bulky compression dressing over there. Sometimes there's the overweight thing is there. Then you apply these muslin bandage rolls over there. Then you go for elastic bandage. Certain you may have seen the crepe bandage. You may have an experience. Certain crepe bandage you can apply it as elasticity. That cloth have elasticity. That bandage have elasticity. So these are elastic bandage. So tightly they can cover that area. They are woven elastic bandage. What they do? They support pressure bandaging, injuries, dressing, stability. Mostly where there is a on the movement joints where pain over there, then you have to put. Sometimes isko kya kehte hain, garam patti bhi, some people they say. So where there is a joints pain, then these are fixed over there. These are known as crepe bandage. You may have known a name of that crepe bandage. It's a high bulk bandage, so mostly it has to be tight wherever there is a dislocation or there is any cut over there. So these has to be fixed. These are high bulk bandage. Mostly the example is of crepe bandage. Then types of elastic bandage, they are what they are? They're heavy elastic webbing containing rubber threads. Sometimes they have rubber thread bandage. They have a special weave, allow it to stretch twice its length. So it's also you can see the pharmacopoeial specification of this crepe bandage over there. It is have the length may be as when it is normal, it is double to the normal length for the crab bandage. Then it is made up of multiple layers at crimped cotton gauze. These are the elastic bandage. So it is made up of multiple layers at crimped cotton gauze over there. Then triangular bandage. You can see in the picture how these are placed over when there's a fracture over there. These are the made up of cloth over there. So these are triangular bandages. Also cut a smart bandage, corner to corner cutting of muslin, then used in first aids. Whenever there's the initial stage, when the patient has fracture, so initially they have to put triangular bandage to hold the organ. Then orthopedic bandage. So what its function is? Function is immobilization support to broken bones, material, plaster of Paris, synthetic cast materials, and plastic sheets can be used in this. What they use? Plaster of Paris, synthetic cast materials, plastic sheets, then and fabricating material. It's a plaster that firmly bound to fiber, maybe polyester, fiberglass. Nowadays, different varieties of these bandages are orthopedic bandages are available just to ease the patient, just to fix the fracture accordingly. Then stockinette used prior to application of plaster of Paris. Sometimes you need see in the picture, these has to be placed just to keep the air or just to heal the wound. They provides comfortability to the patient. So what they do, they stockinettes. Then cast padding. Apply before application of cast, absorbs and allows skin to breathe. Sometimes it has to be under the POP, they have to apply. Sometimes they have to, over that POP, they can be applied. So these are cast padding is there sometimes, or where there is no, the plaster of Paris is not applied. So these are to be applied. They are cast padding over there. Then adhesive tapes, or you may have experience of seen these adhesive tapes. Similarly, you sometimes there's a smaller cut, you have a bandage is there. There's this name of that, I forgot that one. Simple tape is there. You just place over there, and that is adhesives. These all are adhesive in nature, because in that case of bandage, they has to be fixed. They has to be knotted. They have to be fixed with the help of certain type of things. But these are adhesives, so they fix over the place where you have to do. So these are medical and adhesives are widely used in hospitals to secure medical dressings, life support equipments, and monitoring devices onto skin, which requires careful consideration and knowledge about these things, adhesives, tapes over there. So these types of adhesives are, they have natural, semi-synthetic, and synthetic types. The material which is applied over there, they are natural types, semi-synthetic and synthetic adhesive material has to be used. Then further, in natural material is there is starch, gelatin, they may apply. In natural rubber resins, they may use in these type of tapes. Synthetic they apply. Vinyl, acrylics, synthetic rubbers they may apply. Resins, aldehyde, amine base, epoxide, they have to apply. In semi-synthetic, cellulose, combination of both things. Cellulose nitrate, methyl cellulose, etc. has to be applied in this type of tape. Adhesive tapes in pharmacy, the criteria of skin composition, constructions, and functions make the adhesion to skin very challenging. Whenever you need these, you have to apply these. Now, what it has, skin is a self-renewable and replenishable surface, so it can be recovered accordingly. Skin is a low surface tension in certain area over there. Skin is a rough surface with hair folds, pores for sweat, and oil glands and wrinkles. So you have to apply you have to select tape according to the nature of the skin over there. Acrylate, acrylate adhesive tapes. What they are widely used in surgical dressing, where reduced skin trauma is required. Non-luminar fabric backing is used due to hypoallergenic materials based on adhesion, cohesion, and flow properties of monomers used. Second is porous backing materials used are rayon, taffeta cloth, well suited for heavy dressings, paper backed and used for lighter dressings. Other cloth backing, elastic cloth or foam backing are used. Justification used in why they're applied in surgeries because not affected by heat to avoid the heat, light or air, thus has excellent shelf life. Properly stick to skin, long-term adhesion when required over there, permeable to water vapor, so are non-occlusive, hypoallergenic, repeated use with minimal damage. That's why it has to be used. Then rubber-based adhesives, what they do, they are used where strength, adhesion, support, and economy is required. So cloth backed or plastic backed has to be used. Now composed of elastomers, they are synthetic and they are natural. Crab rubbers, naturals, isobutylene, alkyl acrylate, synthetic has to be used in rubber-based adhesives. Now what advantage? Superior adhesion, fixation they can give when you apply these tapes, and economical as compared to other things. Disadvantage, they have yellow colors, rosin, antioxidants, plasticides, coloring agents are made to make it white. So these has disadvantage. They have to be added different things. Now what the farm, because mostly they can produce some allergies. The farms know about what type of allergies they can produce. So what advice and reactions caused by tapes consistent of heterogeneous and complex mixture of organic compound, what they produce, they can produce erythema, redness on the skin, edema they can produce, papules they can produce, they can, whereas balls type they can produce over the skin. So can occur to patients. So firstly, patch testing should be done because some people cannot tolerate these chemicals. So first they have to do for testing before applying these type of tapes. Combined primary, secondary wound dressings. So combined primary and secondary wound dressings, these are also called composite dressing. Have primary and secondary components. Degree of occlusion depends upon dressing types over there. It has bottom layers, they have middle layers, outermost layers. These are well prepared dressing over there. But simplicity of use, simple, you can take over there and wherever you want, you have to apply. It's inexpensive is there, comfortable there. So these are prepared dressing are available. Dressing types, the hydrogels are there, hydrocolloid dressing is there, calcium alginate dressing is there. Then they further go for that. These are cross-linked polymers, example polyvinyl pyridone, non-adherent dressings used as burn treatment, useful in hairy areas. There are hydrophilic colloid particles, fluid absorption occurs. Mass of these dressings consist of gum-like materials, example pectin, bound by an adhesive, example polyisobutylene, useful for low to moderate wounds. Alginic acid is a naturally occurring polysaccharide derived from brown seaweeds, highly absorbent, used on moderate to highly wound, used to pack wounds. Hydrogel dressing is there, where they applied indications. Necrotic wounds, the wound they are dirty, they're near to deform, so painful wounds. And then advantage, reduce wound pain, not adherent. They are placed over there, but they are not non-adherence. Disadvantage. Macerate wound, skin, sometimes attached over there, secured by a secondary, because you need another dressing when you apply this hydrogel dressing over there. amorphous hydrogels are available. Hydrogel dressing is this. Impregnated hydrogels, sheet hydrogels. These advanced type of gels are available. Hydrocolite dressings, where they applied, indication of necrotic wounds as secondary dressing. Advantage over the self-adherent, comfort as fixed over there, no need of extra. They may have bad odor, injured due to the chemical nature, injured the fragile skin. Sometimes they injured the burned skin, whatever it is. So injured the fragile skin over there. Calcium alginate dressing, where they applied for hemostasis, where to close, there the oozing of the blood has to be controlled. Surgical incisions, they have to apply when they put an incision on that area, these calcium alginate dressing has to be applied. Advantage is that it's a non-occlusive, reduced frequency of dressing changes. Disadvantage, distinctive odor, secondary dressing, but sometimes you cannot tolerate the odor of this band, this dressing over there.